Hello, my name is Deanna Vaca Mcghie, and I serve as the Global Advocacy and Partnership Lead at the American Heart Association, where I advocate for systems that promote longer and healthier lives. My passion is to fight for women and improve their health outcomes. And throughout my career, I've seen mothers grieve the loss of a child due to a miscarriage or a stillborn birth. I've witnessed the struggle to pay for medicines, and I've seen the effects of domestic violence on women and their children. Their stories are my moral compass and North Star. I'm honored today to share with you the details of my leadership project. Cardiovascular disease ranks as the #1 killer of women and the leading non-obstetric cause of maternal mortality worldwide. Research has shown us that the difference in the quality of pregnancy care and birth outcome is due to multiple factors such as race, ethnicity, geography, and income. Yet the burden of cardiovascular disease has not been matched by the same level of urgency or resources, and most cardiovascular conditions can be prevented. It is essential that the maternal, newborn, and child health movements, civil society, and national governments act and commit to the necessary resources that are needed for this crisis. Envision a world where pregnancies are free of complications, they save mothers, and produce healthier babies. The most essential resource for this vision is the healthcare provider. Corazón de Mamá, Heart of Mom, brings together the Women's Council of the Inter-American Society of Cardiology and the American Heart Association to tackle heart disease among Latina women in the hemisphere. To catalyze institutional change in our respective organizations, we used the Heart Association's signature program, Go Red for Women, to launch a maternal health equity campaign. The initiative recognizes the importance of clinicians who are often a patient's teacher and advocate. Key to Corazón de Mamás development was identifying how we could empower and build the capacity of these female leaders to use advocacy as a key pillar to advance our collective mission of a heart health for all. So what did we do? During the discovery phase, we worked with a core group of the women, holding a series of listening sessions and exploratory meetings that developed one voice in the Latin America region to raise awareness around the linkage between cardiovascular disease and maternal health. Based on our discovery, we were able to create educational materials that spoke to the cardiovascular risk factors that were faced by women during their childbearing years. These were publicly disseminated across our websites and promoted on key signature days. On this slide is a sample of the campaign's activations that were included on Bump Day in July and World Heart Day in September. All this work culminated to inform the development of a call to action that recommended maternal health policy solutions. Our rallying cry on this document was that all mothers deserve the best care for a healthy pregnancy, delivery, and life following childbirth. Now, as we look at the next phase of our work, we want to be building capacity and advocacy among these women clinicians so that they can begin to engage with government and other members of civil society. We have planned an advocacy workshop to share a policy landscape and resources that would be helpful to creating the groundswell to successfully change policy in communities. We also have started a policy report that focuses on pregnancy in low and middle income countries that will provide us additional guidance in support of a policy brief on the issue. We plan to share our work and this research with global coalitions and also at upcoming conferences. The goal really is to disseminate our work more broadly and gain new allies to the global movement to prevent and treat cardiovascular disease. Together, we can realize a world where pregnancies are free of complications, mothers live, and babies thrive. I am deeply grateful to Dr. Johanna Contreras, my volunteer lead. She's been championing this effort by my side at the American Heart Association, especially our efforts to build a network of cardiologists committed to our global programs. Thank you to the phenomenal WomenLift health community. Thank you for cheering me every step of the way and reminding me that my place is at the helm because each one of us can change the world one passion at a time. Muchísimas gracias from my corazón to yours.